Thank you so much for all of that. And I do want to start by saying that working on this project has been one of the truly great honors of my career. As you've heard from a few people and you'll be hearing from more, this is an amazing group of people from all different sectors that have come together to really try to solve a very thorny issue that's affecting families in Fresno and throughout the country and the world. And I just feel quite honored to be a part of it. So as you heard, while we were wrapping up the feasibility study, we saw that we really wanted more funding in order to test the effectiveness of this program compared to individual care. So we applied to PCORI to do a comparative effectiveness study, which actually we called Comparing Approaches to Enhanced Prenatal Care to Improve Maternal and Child Health in Central California, because that is what we propose to do. Obviously, that's quite a mouthful. So the moment we got the funding in September of 2019, we went back to our community partners and stakeholders to come up with a name that would be more meaningful to our group. And what we came up with, EMBRACE, that stands for Engaging Mothers and Babies, Reimagining Antenatal Care for Everyone. Next slide, please. So before I tell you about the project, I want to really introduce you to the spectacular village. We use village a lot here, but as you will see, it's truly taken, I would say, several villages to make this project happen and flourish as much as it has. So it's a dual PI mechanism. So the other PI, the Fresno PI, is Lauren Lassard, and Lauren is on maternity leave. She just had her third child. And this is the team at Cal State Fresno and UCSF Fresno. And as noted, Dr. Curry is our Director of Engagement, of Community Engagement. Next slide, please. Here's the team at First Five that is also doing a spectacular job of running the GLOW program. And again, it's just been so wonderful having a chance to get to know not only Fabi, but her great team at First Five. Next slide. And finally, at UCSF and the California Preterm Birth Initiative, we have a whole host of researchers working very hard behind the scenes to make sure that this, to make the study happen, and you see them pictured here. Next slide, please. So it's a comparative effectiveness study, as we've noted, and the first comparator is the GLOW model, and you've heard a lot about that already, so I really won't go into the details. We call it GLOW/GC in the study, GLOW Group Prenatal Care, and what's important to note is that this model, which as you can see, women really, really like, at this point is only available through the study in Fresno. Next slide. Our other comparator we refer to as CPSPIC, and that's individual care, that's what the IC stands for, with additional services that are offered by the California, the Comprehensive Perinatal Services Program, or CPSP. And this is a program throughout the state of California that is offered to women whose prenatal care is covered by Medi-Cal. And so it's a form of enhanced prenatal care. It also offers nutritional services, psychosocial support, health education, and case management. And that lasts from conception through 60 days after the baby's born. The program is funded by a Title V MCH block grant, and it's implemented by providers and practices in Fresno and overseen by the county level CPSP coordinators. Next slide. Importantly, EMBRACE is a randomized study. In order to make it more palatable to the community, however, the randomization is at the level of provider, and we randomize the order in which they're able to offer GLOW versus the individual care. So this is a schematic that sort of describes that. And basically, participants who meet the criteria are allocated to one of these two forms of care, depending on who their provider is and what their due date is. As Fabi mentioned earlier, for GLOW, you need to have women at more or less the same gestational age together. Next slide, please. The study has 3 aims, each of which address a different set of outcomes. And I think you'll hear something that sounds very reminiscent all the way back to the recommendations from the AIM report. And again, this has been super important to us to honor the needs, the desires of the community in terms of what they feel is important to address. So the first aim does address preterm birth. We are the Preterm Birth Initiative, and group prenatal care is one intervention that in some studies has been found to be associated with lower rates of preterm birth. So we are studying that quite rigorously to see whether the GLOW model will reduce preterm birth among women in Fresno, comparing it to the individual care. The second aim, and perhaps this is the one that's most of interest to this webinar series, is mental health. So our primary outcome for that is depression, and we are measuring depression during pregnancy and at 14 weeks postpartum, which is when postpartum depression peaks. Again, hypothesizing that women that have been in the GLOW model will have less depression and anxiety than women in the individual care model. The third aim focuses deeply on the patient experience, again, focusing on perceptions of both respectful and disrespectful care, as well as their satisfaction with care. And given the importance of this aim, we are taking both a quantitative and a qualitative approach so we can get really nuanced understandings of what these patients are experiencing. And you'll hear a little bit more about that in a moment. Next slide, please. So to be eligible to participate in Embrace, you of course have to be getting your prenatal care at one of the sites where the study is being conducted. You can be up to 24 weeks pregnant, and participants need to speak either English or Spanish. So we have English and Spanish language group prenatal care groups. All the instrumentation is available in both of these languages. All women to be eligible for the study must be low income. The vast majority are on Medi-Cal, but we also include people who meet financial criteria for Medi-Cal eligibility, but are not covered by Medi-Cal. And importantly, all of these women need to be willing to receive their care through either of these 2 models, as this is a comparative effectiveness study. Next slide. Unlike other studies of group prenatal care, high-risk patients are eligible for this study. So that means that women who have comorbidities, who are carrying multiple gestations, and who have previously experienced poor pregnancy outcomes are eligible to participate. Next slide. Again, with preterm birth as that very important outcome, our aim is to recruit 2,600 women, which is quite an ambitious goal. I see Fabi nodding her head, and we're all working together to ensure that we'll be able to recruit that sample size, which will be about 1,300 per group. So 1,300 women who will have GLOW and 1,300 women who will have individual care. And basically the sample size calculation is here, but basically this is the number that we came up with so that we could offer conclusive findings about whether or not this form of group care, the GLOW model, reduces preterm birth. Next slide. So as I mentioned, this study only started in September of 2019, and we hit the ground running such that 6 months later, we had already onboarded 5 of the 9 providers who were going to be involved in the study, and a full 101 women had enrolled in the study. And this took so much effort, and our entire team was just ecstatic about how well it was going. And then, of course, as we all know, COVID hit. So, needless to say, we immediately stopped enrollment, although we did continue to collect data on the participants who had already enrolled. And we immediately began thinking about group prenatal care in the context of COVID and wondering whether we would be able to adapt this model for telehealth so we could continue offering GLOW. Next slide. So we applied for one of PCORI's COVID enhancements, and again, are very grateful to PCORI for funding the Enhancement Project. And that's what we're in the midst of now. The project has 3 aims. We're conducting a very in-depth qualitative study that you will hear more about in a moment from Dr. Chambers. But basically we're focusing on what the effect of COVID-19 has been on the lives of pregnant and birthing low-income women in Fresno. We are taking a deeper dive into the experience and needs of African-American women, again, hearkening back to the AIM report. And for the whole group, all these women, we are trying to get a better understanding of how they would view the prospect of participating in group prenatal care via telehealth. The second aim is to use this data as well as data from a wide range of interviews that we've been conducting with community members and other stakeholders in the form of a community-based participatory research process. And we're going to be pulling, or we are pulling all that together to create a telehealth-enabled version of GLOW that is reflective of the changes in economic circumstances and social needs that women and families are experiencing, and also is more accessible for or appealing to African-American women. And the final step of the enhancement is to do a pilot test of this modified program among 40 women. Next slide, please. We do have some very preliminary findings. As I mentioned, we continued interviewing the COVID 101, we call them. So that's the 101 women that enrolled prior to COVID. We added numerous items and survey and instruments to the survey that focus on COVID, worry, financial hardship, and discrimination. And all of the women have completed the 3rd trimester questionnaire, so we began to analyze that data cross-sectionally. Not surprisingly, we found that COVID worried is indeed associated with increased stress in this population, that economic stress and hardship is widespread, and nearly half of the participants report experiences of discrimination. And so now I'm going to turn things over to Dr. Brittany Chambers, who's going to tell us about the voices of these women.